Everyone, I want to thank especially the members of the media for their patience this afternoon, and also for the people that came out to participate in the meeting here in our new location, temporary location. So I want to think most people know who I am, the County Executive, Jim Barsha, and I just want to thank everyone who's here for your patience. Also, thank the dedicated staff and managers of the county government who are working under, unusual conditions, but doing a great job. And we're going to be certainly providing those essential services that we're mandated to provide to keep our community safe and hopefully healthy. And so I'm going to be introducing, and I know the chairman wants to make some remarks, and I'll be introducing our Director of our Health Department, Joel Strauss, but I want to make a few opening comments with your indulgence. So I would just say we are concerned for everyone's health and safety during this coronavirus disease pandemic. Due to the nature of COVID-19, proactive directives from Bay County Health Department, as well as measures taken by both the federal and state governments, have prompted us to change the way we do business here in Bay County. Much has changed in just a short period of time, and we will be following all mandates put forth by both our local unit and Governor Whitmer's executive orders. To remain as efficient as possible, all communications to the media and our constituents from this point forward will be coming from the office of Joel Strauss, Bay County's Public Health Officer. As you already know, the Civic Arena and Community Center, aside from this event, have already been closed to the public and are not operational at this time. As of this morning, the offices in the Bay County building have also been closed to public foot traffic. However, services will still be provided to the public as our workers will still be reporting. Please contact the department with which you need to do business by telephone to see what their procedures will be during this closure to the public. We also will have a telephone directory for this purpose on the Bay County website's homepage at www.baycounty-michigan-gov. As a county with the highest percentage of citizens 60 and better, it is imperative that we take steps to flatten the curve of this pandemic to ensure our health systems don't get overwhelmed. We are going to be taking all necessary steps to help stop the spread of this disease in our community while continuing to provide the services that are needed. I have faith that Bay County's Public Health Officer, Joel Strauss, will successfully guide us through this process. And with that, I'd like to, at this time, introduce Joel Strauss, our Director of our Public Health Department here in Bay County, and taking the lead on this national disaster that we're facing. Hopefully we will get through this, but it's going to require a lot of us working together and the public being very concerned about not transmitting this virus to any unsuspecting fellow residents or visitors to Bay County. So Joel, would you want to step forward and offer your comments? And I believe the chairman will follow the director. Thank you.
Thank you, Jim, for the kind words. I'd like to spend the next few minutes giving you a succinct summary of activities here in Bay County. The Bay County Health Department has fully mobilized its staff and resources to address the threat of the virus. To that end, we have cut back significantly on clinics and services so that we can fully help the community at large. As you are all aware, we have had one presumptive case as of last Friday. We have worked diligently with Saginaw and Midland counties, as well as Covenant Healthcare, reaching out to those people that were affected. We have contacted nearly 24 individuals associated with this case, and in some cases have had these individuals self-quarantine for the 14-day process. Currently, it is our estimate that approximately 30 individuals have been tested, and those tests have been submitted to state and private labs in conjunction with having symptoms associated with the virus. We know at least 7 of these tests submitted have come back negative, and we are waiting to hear about the remaining tests. It is estimated that 15 individuals are currently or have been admitted to inpatient with symptoms similar to coronavirus. As you are all aware, there have been significant delays at the state and national level regarding testing. Currently, even the Bay County Health Department does not have enough testing supplies to distribute to local providers. The state of Michigan at this time can only process about 150 tests per day, but that is being ramped up. But there has been further confusion from the state and the federal government regarding tests, and some private sources such as Quest and LabCorp have also had difficulties with supply and distribution. We have been told that that is on the mend and that the supply and distribution of laboratory tests will ramp up. Nevertheless, we are working diligently with local providers to obtain and distribute testing supplies and personal protective equipment. We have been working with a wide range of local providers to ensure that persons who are symptomatic after receiving care, if necessary, as well as plan for the anticipated surge of cases to come. I want to thank Clarence Civilian, Megan Saman, and the staff at McLaren Bay Region for all of their efforts for being excellent corporate citizens with their collaboration efforts. The Bay County Health Department is in constant communication with McLaren Bay Region, and we are committed to finding the best solutions to the coming problem. We are working with local fire, police, fire, rescue, and EMS agencies throughout the county so that we can fully respond to the needs of local residents and not overtax our essential services. We have ordered the closure of county facilities to the general public, including the county building, the community center, the ice arena, and other facilities, so that we can stop unnecessary interaction that might inadvertently spread the virus. We need to keep our local residents healthy as well as maintain a workforce that responds with essential services. We have enforced the governor's prohibition on public assemblages, including the closing of indoor services at bars and restaurants, as well as schools and places of worship, etc. Our sanitarians in the Environmental Health Division have diligently provided counsel to licensed food establishments here in the county after these closure notices so that they may continue businesses through takeout and curbside service. Our efforts continue unabated, and although much has been accomplished in such a small amount of time, there is much that needs to be done. The uncertainty of this situation brings a great deal of anxiety to everyone, but our job is simple and clear. We need to flatten the curve. We need to make sure that the healthcare and emergency response system is not overwhelmed. We need to ensure that all Bay County residents are doing their part to fight the virus. We need to ensure that our efforts together will keep the county safe and healthy to the greatest extent possible. We must protect all Bay County residents, but especially the most vulnerable. As Jim stated, the people who are most likely to have severe disease and complication from coronavirus, or COVID-19 as it's known, are older individuals and those with other medical conditions like heart, lung disease, diabetes, and obesity. This is especially important as Bay County has the highest percentage of persons over the age of 60 in the state of Michigan, or 1 out of every 4 residents. So in order to reduce the spread of coronavirus, we're asking Bay County residents to do their part and follow these recommendations from the Centers for Disease Control. First and foremost, maintain social distancing of at least 6 feet. Wash your hands often with soap or water or use hand sanitizer. Avoid touching your eyes, nose, or mouth with unwashed hands. Cover your mouth and nose with a tissue when coughing or sneezing. Avoid handshakes and contact with people who are sick. And clean and disinfect frequently touched surfaces. But most importantly, if you are sick, stay home. If you are caring for a loved one at home, stay home. Everyone must do their part. The most recent information collected suggests that the virus may be easily spread from people with little to no symptoms. So once again, I implore you as the public health officer of Bay County to do your part and avoid the large crowds and follow these recommendations. And with that, I'm going to turn it over to the chairman of the board, Michael Durancheck.
Thank you, Joel. I just want to let everyone know that the Board of Commissioners is completely behind the staff that we have at Bay County. We're very fortunate. Our county executive and our health director doing a great job. And we're not giving up on the senior citizens and things like this. We are going to continue, as we always have, with our Meals on Wheels program, which is a home delivery, which is very important. Some of the time, this is the only good meal that these folks get. So for the time being, we're going to be able to do that, and we're practicing as best as we can with, of course, the washing and sanitizing and everything else. We got a great team here at Bay County, and I'm proud to be a member. Thank you.
Anyone have any questions at all from the media or anyone in the room?
I have a question for you. I heard you mention earlier that, by announcing this state of emergency, this will help provide resources to the county. And I also heard you mention that because Governor Whitmer has issued a state of emergency and President Trump has also issued a national state of emergency, that will this help as far as, getting the county resources?
Yes, it will facilitate our receipt of federal and state resources to help us combat this virus and carry the battle here on the ground at the local level. But I'm not sure if either Joel or Mike would want to add to that. Joel, is there anything?
I think also importantly, it frees up county resources to use at the discretion of the county executive so that we can quickly and effectively fight the virus.
There has been discussion coming out of Washington. We don't have anything firmed up or anything, but it would appear as though they're going to come up with a stimulus package and everything to not only to take care of the COVID-19, but to give us a boost with the economy for these people that are been impacted seriously by their servers and waitresses and waiters and stuff like that. So by doing this state of emergency, we're hoping that we will have our ducks in a row and ready to proceed in case there's grant applications available.
And what's the next step now that you have issued this? I mean, do you have to issue the state of emergency to Governor Whitmer, or where does it go? And then when do you expect to receive word if you'll get resources?
We'll be communicating that to the executive branch in Michigan as well as the Michigan State Police. And I believe, Ryan, the Emergency Management Division, right, of the Michigan State Police. And that will also, of course, as you were here for the meeting, and the board graciously and generously approved $150,000 as a result of our declaration of emergency, so that we will have the funds to carry this battle out throughout the county and protect our residents from exposure.